Hi, everybody. Welcome to our power lunch. We are going to have a fun topic today. So we're just going to really talk about what's in the news, what's going on in the industry, and really what your CEO is reading and kind of some of the new headlines in the news today. So that we'll make these slides available right after the seminar, and they'll be available on my webpage, as you can see right there on that first slide. So it's easy. It's mbgrayhealthcare.com. So you can log over later today and see this slide presentation. Although there's not a lot of slides in today's agenda, we tried to make this one a little bit more fun. Summer has started. Kids are home from college. I know I have one that sleeps most of the day and stays up all night, so that's always interesting to have him back in the house. So this agenda today is going to be very loose. We're just going to talk a little bit about what's in the headlines in regards to healthcare. We're going to try to not focus on politics, although lots of you know I spend about from about 5:30 a.m. to 6:30 a.m. reading the news every morning. And it's actually hard to find news these days on healthcare, which is surprising because it used to be front and center, but some other things have taken the lead, I think. Some things with Russia and some other things. So we're going to focus on healthcare news today, and we're going to touch on the following bullet points and really talk a little bit about how that's changing the way that we're going to be doing things in the future. We did in our last power lunch in May talk about the cognitive artificial intelligence. That was the main topic of the session. And I'm very excited about that. Interestingly, right after that power lunch, I attended the Marsh Global Leadership Meeting. And Peter Zafrano, who is Marsh's global CEO, he heads up not only Marsh McLennan Agencies, but he is the head of Guy Carpenter, Oliver Wyman, and Mercer. He spent a good portion of his hour talking to the leadership team about just that cognitive artificial intelligence and really how it's going to shape and change our industry, not just on the healthcare side, because he represents obviously the entire Marsh business, including the property and casualty pieces, but in insurance in general, and how this cognitive artificial intelligence is really going to change the way that insurance companies price risk, look at risk, and analyze things. Back in the day, so most of you know me and know I started off my career at Aetna about 17 years ago. Really had a lot of arguments with underwriters about pricing and how they were looking at the risk. And, obviously I was always after better pricing and they were always trying to be too conservative. And those days are changing. Those days are gone. There's a lot more metrics and a lot more software and a lot more, computerization going on when it comes to really looking at risk, assessing risk, and really pricing things. So that's definitely something to come. In our session last month, we have about 100 clients on the telephone today. We had a lot fewer last month. But one of the things to kind of recap what we talked about last month was IBM Watson's approach to oncology and how it's changing and shaping how oncologists are delivering care and solving for issues. Interestingly, they have IBM Watson, obviously, who won the Jeopardy championship several years ago. But really looking at how they take all of the pieces of information that are out there, research papers, just reams and reams, just on breast cancer oncology, there's 8,000 informational periodicals, journals, and research papers published every single day. And IBM Watson is able to take in all that data and remember. So it's really something that IBM has rolled out to partnerships with MD Anderson, Sloan Kettering, the Cleveland Clinic, some of the premier cancer institutions in the country, to try to share this new way of looking at the latest and greatest treatments, protocols for things that, an oncologist can't read 8,000 research papers every day and still take care of their patients. So very interesting, game changer for us. Interesting conversation, but it spans not only healthcare, but it's spanning across the industries. And interesting that our CEO chose that as one of his topics for what's challenging and what the conversation is going to be in the future. And then, of course, we're going to talk about healthcare as a business performance strategy. One of the things that we want to make certain is that you understand and we're all cognizant of how healthcare, which is now second to payroll, is on the front burner for most CEOs and certainly the executive suite. They're focused on absence management and really just this big ticket item being more than just a budgetable expense, but more of defining it as how do we change this conversation into a business performance strategy. So we're going to spend a couple of minutes talking about that. Of course, we'll hit healthcare reform because no day would be complete without talking about legislative updates on healthcare, specifically the taxability of healthcare benefits. That's been in the news this week. It's been front page at least 2 days. And then, of course, we're going to highlight some of the changes that are going on in New York with the family paid leave law that's changing in January. So if you have employees in New York, that's something that you want to pay attention to. And we've put all of these updates, tried to keep the web page very current and up to date. So with that long overview of our agenda, this is only 20 minutes. And again, we said this was going to be a fun one with just kind of updates on legislation. So the CBO came out. We all know that the House passed healthcare reform, the AHCA, the new American Healthcare Act. It was passed in the House with a slim margin of 2 votes. But now it sits in the Senate, and the Senate has a lot more information, including last week the CBO came out and ruled on how much it's going to cost, or in this case, save, and how many increased uninsureds there will be due to the significant subsidy changes. So we know that it used to be based on income. Now it's based on income and age with the new proposed legislation. Just to pontificate just a little bit, because the day wouldn't be complete without my opinion, I guess, on something like this. But having done this for 30 years, I just can't imagine that bill passing in the form that it's in today, just because I think it would be unstabilizing the exchanges and certainly the individual marketplace. What remains kind of a game changer for us is the excise tax, which is still in effect under the old law, which is still the law of the land for 2020. So many clients are saying, how do we plan for this? What are we looking at? And what the thing that I would say is 2 things that might be significant for us. One is the excise tax. Certainly, we have to watch that for 2020. With the legislative change, potentially it could change to 2026, which is what the Trump care bill has in place. But certainly, if nothing changes, and I don't anticipate that bill passing, at least in the form that it's in today, we do need to plan for that. So as employers, one of the challenges that we continue to face is the cost of healthcare, right? So one of the things that we want to focus on is the all-in annual cost per employee and per family of healthcare benefits to make sure that we're watching that threshold on the tax and doing that calculation every year to make sure that we're minimizing or mitigating that tax to the best of our ability. And I think if you look at the prevailing, we'll get back to this slide in a minute, but if you look at the prevailing challenges and the prevailing thoughts behind how to prepare It's really just to keep rolling with our strategy. Whether Trump Care passes or Obamacare stays in place, the current legislation, we really still have to be keeping our eye on the ball and watching our costs and watching certainly that per employee annual cost to make sure that we're keeping that as affordable as possible. There have been significant opportunities with some of the consumerism tools that have hit the market. And certainly the consumer-directed health plans and having employees with a little bit more skin in the game will definitely still remain a front and center strategy. I think most employers, this year are trying to figure out how to increase the movement out of the standard or more conservative PPO plans, the 80-20 plans that have been in place in the past, and moving people into these consumer-directed health plans with high deductibles, coupled with an HSA to help them manage that cost with an employer contribution. The employer contribution from all of the surveys for 2017 is still someplace between $800 and $1,000 into the HSA for people participating in the high deductible plan. And then kind of backtracking, one of the other things that we're watching very, very carefully, game changer for employers, and certainly how we offer benefits, is the tax exemption of healthcare benefits. So one of the things being talked about, and Paul Ryan has specifically stated that he feels that having employers be able to deduct tax the cost of healthcare as a tax deduction is discriminatory to the individual marketplace. So he's saying that that's an advantage that the individual marketplace doesn't have. I will tell you that this will be an extreme game changer for employers if that tax deductibility changes. And it's a big bucket of money. From the slide that you can see right up in front of you, you can see that's an enormous opportunity for the government tax-wise to grab a lot of money to pay for things. So that's something that we're watching pretty carefully. And again, I think it's really block and tackling. We just need to keep doing what we're doing and be focused on what we're focused on. A lot of prescription drug information out on the marketplace today. For those of you who watch the news, there are a lot of specialty drugs and biologic drugs in the pipeline for FDA approval this year. I think there's over 70. And typically those are over $1,000 per script. So there's a lot of conversation with CEOs that are reading about, these significant increases in cost of pharmaceuticals with, what's the game plan? What are we doing to manage this? And there are very, very credible strategies that aren't disruptive to employees that can really help manage that. And for specialty drugs, it's really important to get out in front of some of those new drugs coming out to market and making sure that your PBM or your carrier partner has the proper clinical edits in there to make sure that folks are trying the less expensive drugs before they move into the more expensive drugs. And certainly the biologics, the split refills, and the other tactics that we're deploying have definitely been effective. Prescription drug today is 26% of the overall cost of our healthcare benefits. So certainly something that deserves a little bit of our attention. Certainly, this is just kind of, joking, but there's a pill for everything now. And the advertisements on TV, you sit and you watch TV at night with your family, and there's always one or two drug commercials. So changing the conversation, one of the topics that I just wanted to touch on, because I think a lot of CEOs and a lot of CFOs specifically are thinking about healthcare in a little bit different light these days. This particular model that we use, we've actually taken a step back. And so what we've challenged our leadership team with in the last year is, if you have 800 clients that are going through renewal every year, what is the difference? What is the significant difference between an employer group going through renewal with an 18% trend increase versus a business that has a 2% trend increase? So, what we did was we took a step back and we said, what is the business doing, right? That's getting a 2% increase versus an 18% increase. So what we did is we put a business strategy matrix together. We call it the total opportunity matrix analysis. And these are some of the things that we are looking at in kind of the conversation to change the way that we look at healthcare benefits and changing it being an annual budgetable item into more of a business strategy. And if you really look at all of the statistical data, health and well-being equal productivity. There's no question. And for major businesses, they're really looking at how can we make this a business strategy to make sure that people are healthy, they're productive, and they're at work working and delivering the things that we need to deliver. So if you look at some of the things within the matrix, we're looking at, the optimal benefit plan design. A lot of my clients are family-owned or very paternalistic businesses, and back in the day, I think the prevailing thought of the C-suite was we want to offer robust benefits, really, amazing benefits, so that our employees have the best in the marketplace. We want to be an employer of choice was the word that was thrown around a lot in the last 5 years. And really that's changed a little bit. Businesses have come to realize that when healthcare is free, people are not as responsible with how they use healthcare benefits as if there is some skin in the game with the consumer-directed health plans. So that optimal benefit plan design has changed. And really looking at the benchmarking, you can tell whether you're in the benchmark norm, you're richer than the benchmark norm, or you're a little bit, you have a little bit of a ways to go to get to the benchmark. And then, of course, workforce health, absenteeism, management of disability programs, plan management, how are we managing the plan? What type of clinical programs do we have in place? Vendor networks and services. A lot of talk these days about the high performance networks or the narrow networks are things that people are really thinking about, especially in very competitive, dense areas where there's lots of options. And of course, employee engagement, how you engage your employees or what types of wellness programs that you have. The consumer-directed health plans with the HSA contributions have really allowed us a lot of new ways to engage employees by helping them with opportunities where they can earn dollars into the HSA for participating in some of the wellness things. So that's come a long way. And I think, when you take a look and you take a step back and you look at kind of our overall view on healthcare, one of the things that we've tried to do is, not get sideways on healthcare reform and worrying about what's going to pass and how it's going to affect us. Because really, as employers, there's not a lot that's going to affect us with this legislative change. It's mostly in the individual market and the federal and state marketplaces that things are going to change. But the things that we need to keep worrying about are, the cost of healthcare, the prescription drugs, what is driving our trend, taking a look at the data, the things that we've always had to be focused on, and keep blocking and tackling and moving things forward with a good, solid strategy, which takes place in the first quarter. Right now, we're in the midst of deploying those strategies, and a lot of my clients are looking at the marketplace for opportunities to expand and really focus on new strategies. We have a lot of second opinion opportunities where, a lot of employers are really looking for 2018 at putting in mandatory second opinions for surgery and things like that, and providing employees with easy, accessible ways to get that second opinion. Best Doctors, There's the teledocs of the world, where you can get second opinions for things via the phone line or the internet or webinars and Skype. So a lot of different ways to look at well-being, health, and productivity. And really, today we just wanted to kind of hit some of the news items that are in the news real quickly to kind of tell you a little bit about, what's front burner. Certainly, I think it would be a huge mistake if Congress passed the taxability on healthcare benefits. Because if you look at somebody who's getting a $400 a month contribution from their employer, you're going to have to pay tax on that. And then they would have to pay tax on the portion that they're contributing, which obviously would be definitely a game changer for all of us. So with that said, we rounded the 20-minute mark, and I promised we would keep these to 20 minutes. See how fast 20 minutes goes? Kelly, I think we need to make them like 25 minutes or 30. But we did post a ton of new stuff on my webpage. It's the easiest way for me to communicate with everybody that kind of follows us. We have over 3,000 people signed up for the news updates that I send out, and we've had a lot of traffic to the website. So we put up the PCORI fee that is due on August 1st. There's 4 acceptable ways to calculate that fee. So if you need more guidance on that, that is on the webpage under news alerts. The HSA and high deductible plan limits for 2018 were just released from the IRS. I've posted some interesting webinars that might be of interest to you that are not part of Trion, so I'm not responsible for their content, but I thought they were interesting, so I put them out there. Obviously, the FMLA advice from Think HR. Think HR is an organization that Trion teamed up with because, Trion is a benefits consulting firm. We don't really, we don't do employment law. So we teamed up with Think HR. For our clients, it's free. You can buy it individually as a company if you're not a Trion client. But they do a lot of interesting webinars, links, advice to things, and you can see some of those I've posted on my webpage. And of course, January 1st, we have the New York Family Paid Leave Act coming, and some information that's just been released in the last 2 weeks is posted on my webpage as well under news alerts. So Kelly, I think that wraps it up for me. If anybody has any questions, we're a little bit over, but I tried my best to keep it to 20 minutes. Hope everybody enjoyed our session today. And certainly I'm always here if anybody has any questions. You have my contact information on this last page.
Wonderful. Thanks so much, Marybeth. Our next Power Lunch is going to be the first Wednesday in August 2nd.
Yes.
We're going to skip July.
We're taking a break for July because of the July 4th holiday. So we won't be having one in July, but we'll reconvene in August.
And we'll send that link out as soon as it's ready, so you can go ahead and register for that. And thanks again, Marybeth, for a great webinar. We'll see you next week in Chicago.
Yes, looking forward to seeing everybody in Chicago. I love Chicago. It's a great city, and Chicago in July is a great time to be there.
June. Yeah, it'll be even better.
June. Yep, June. Sorry. Yep. All right. Thanks, everybody.
Have a great afternoon.